So Danielle, we did your case about 1.5 years ago, and then you were my first and only infection.
Yay.
Right after this, because you had gotten splashed by some stuff in a hospital a couple days before, right?
Right.
And so things grew well, except for a couple little areas where you had the infection. So we're going to fix that today with a modified FUE, and hopefully this will work well and you won't get infected.
I hope so.
Did you have much pain last time?
No.
Okay. Just it was all irritated and raw looking, and we tried you with antibiotics, and then finally you had to see an infectious disease doctor, right?
Mm-hmm. Correct.
So Danielle grew well, with the exception of 2 spots, right here and right there. So we'll just do a little modified FUE to address these spots. It should be easy enough. Okay, so we're just going to start. If I do anything that hurts, tell me. You're filming, right? Hold on. Mm-hmm. So we come in with the elliptical punch. Let me just keep going down. And so we have a nice little specimen that has, I don't know, 10 or 12 hairs in there. In almost no time at all.
You missed it.
Let's do one more. We'll close these 2. Why don't you put yours right there? There you go. You okay, Danielle?
Mm-hmm.
Okay, come out with the punch. And there's just no trauma on those roots when we lift it out like this. There's no avulsion. And it's just perfect. So then we just take 120 nylon. There's no cautery needed. Can you trim that? Let's do one more here. And so these guys are closed with really no tension. And we know it's going to heal well. I mean, we did a strip scar right here last year, and you can hardly see that. So you just know that these little minimally tension closed punches are going to close with leaving almost no scar. And we got strip quality hair from a small individual punch without any avulsion on the roots. So that's the whole principle of MFUE. So we've taken all the little punches, and she's got really fine hairs, typical of female type male pattern baldness. And I just think FUE would have been pretty dicey on that. And she didn't want to go through another strip again, even though her strip, which you can see just below where we were before, turned out fine. So Danielle, you said to me, what did you say? You said something like, this is a great option.
If people have a small area, this would be a great option because it's successful instead of plucking out each individual hair.
Right, because we had talked about the FUE, or what you called plucking, particularly with your fine hair, just being less consistent, right?
Yeah.
And did this hurt when I did this?
None of it.
All right, well, great. So from now on, it's just a regular hair transplant. We'll move you to the other room and get the rest of it done. So Danielle, I've numbed you up and made the recipient sites. How much have I hurt you so far today?
Nothing.
And the I know you had a strip by me a couple years or a year and a half ago, doing those little modified FUE extractions. Hurt more, less, same?
Same.
All right, so again, it's just a regular hair transplant at this point. We got most of the grafts cut, and we get them put in and finish up. So one area is done. Wendy, are those like FUE grafts or strip grafts?
Strip.
They got nice root bulbs on them. I'll hold it over the slits there. Yeah, that is a nice thick root. Okay, so Daniel, we're all done, and we got 571 grafts out of you. Those are really strip quality grafts. That should really fill in those two spots. Did it hurt?
No. Wendy was very gentle.
Good. And you just made the comment, it's hard to believe that you got that many grafts out of those little...
Yeah. It's amazing.
Yeah. All right. We'll see you tomorrow.